Your penis is sending you messages every single day. Messages about your heart, your hormones, and your future health. Most men miss these signals until it's too late. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to walk through 10 essential truths about penile health, things that can protect your function, preserve your confidence, and possibly even save your life. Some of what I'll share might surprise you. Some might challenge what you've heard before, but all of it comes from years of clinical practice, from real patients with real concerns, and from a deep understanding that your sexual health deserves honest, compassionate care. Before we begin, I want to ask something of you. If you've been watching these videos, if this information has helped you understand your body better, please consider subscribing. Many of you watch but haven't subscribed yet, and that makes it harder for this education to reach the men who need it most. Share this with someone who might benefit. Let's break the silence around men's health together. Section 1. Don't ignore your penis, it's talking to you. The first principle is deceptively simple. Pay attention to your penis. I know that sounds obvious, but hear me out. Most men only think about their penile function when they're about to have sex, when something goes wrong, or when they're comparing themselves to others. But medically, the way your penis works is one of the most accurate indicators of your overall health. There's a powerful statistic I want you to remember. When we follow men who develop persistent erectile difficulties, not just one bad night, but ongoing problems, about 14% of them experience a heart attack within 7 years. 14%. That's not a coincidence. In medicine, we often call erectile dysfunction the canary in the coal mine. I prefer to think of it as your body's early warning system. When you have strong, reliable erections and healthy desire, it tells us that several critical systems are working well. Your blood vessels are open and flexible. Your hormone levels are probably in a good range. Your nervous system is functioning properly. Psychologically, you're not being crushed by chronic stress, and you're not exposing yourself to substances that damage vascular or nerve health. So when your penis stops working the way it used to, don't just shrug and blame it on age or stress. Listen, your body is speaking. The sooner you hear it, the sooner you can protect not just your sex life, but your heart, your brain, and your longevity. Section 2. Don't try home remedies or DIY treatments. Number 2. Avoid do-it-yourself treatments for your penis. There's a powerful combination that drives men into dangerous territory: insecurity, silence, and the internet. When a man is worried about size, performance, or appearance, he often searches in the shadows, forums, random videos, anonymous before and after photos. This is where so-called miracle cures and home remedies live. Let me be very clear. There is no safe home method that will make your penis significantly longer or thicker in any meaningful, permanent way. No oil, no cream, no random kitchen ingredient is going to grow your penis overnight, no matter what an ad or some stranger on a forum promises you. One of the most absurd things I've seen circulating is the idea of pouring apple cider vinegar or other acidic, irritating substances on the penis to stimulate growth or boost testosterone. Besides making no physiological sense whatsoever, this can cause burns, irritation, and injury. Then there's gelking, which many men hear about online. Gelking involves using your hands and significant pressure to stretch the penis based on the belief that it will increase length or girth over time. The problem is that when men do this, especially aggressively and repeatedly, they can cause repeated microtrauma to the erectile tissue. Over time, this trauma can lead to scarring, curvature, pain, and ultimately erectile dysfunction. Every urologist has seen young men who went down this road because someone on the internet guaranteed results, and men rarely do things halfway. When a man believes something will fix his deepest insecurity, he's going to push harder, do it longer, go to extremes, and then he ends up with irreversible damage to his penis. So please, don't do it. Another dangerous category is homemade constriction devices. Constriction rings, when handled and used correctly, can be useful tools for maintaining erections in some men. They're designed to be flexible, removable, and safe when used properly. But every year, men end up in emergency rooms because they improvised. I've seen real cases of men placing metal nuts, rings, or pieces of hard plastic around the base of the penis to trap blood, and then being unable to remove them. When the penis swells, these rigid objects become prison bars. At that point, this isn't a joke. It's a medical emergency. Sometimes, fire department tools or specialized saws are required to remove them. The longer the device stays on, the greater the risk of permanent damage. If you think a constriction ring might help you, buy an actual medical product or a sexual health product designed for that purpose. It costs very little compared to the cost of emergency surgery or permanent loss of function. The principle is this: your penis is not a DIY project. If something concerns you, talk to a professional rather than experimenting on your body. Section 3, keep it clean, but treat the skin with respect. Number 3, keep your penis clean, but treat the skin gently. Most men understand they need to wash their genitals. The problem is more in the details, especially when there's a foreskin involved. If you have a foreskin, you need to regularly and gently pull it back, wash underneath, rinse well, and dry. If you never retract the foreskin, sweat, dead skin cells, and secretions can accumulate and form smegma, which can lead to irritation, odor, and infections like balanitis, which can be painful and uncomfortable. There's another important reason to make sure you can fully retract your foreskin. While penile cancer is rare, when it does occur, early detection matters. If the foreskin is too tight to ever see the head of the penis or the skin underneath, early lesions or abnormalities can hide for years. So if you cannot pull your foreskin back at all, or only with pain, this isn't just an inconvenience. It's a medical issue called phimosis. Talk to your doctor or a urologist. In many cases, topical creams, gentle stretching, or minor procedures can help. In some cases, circumcision is the best option. But living with a foreskin you can never retract is not a healthy long-term plan. On the other side of the spectrum, there's overcleaning. The skin of the penis is delicate. It doesn't need harsh, heavily scented soaps or aggressive scrubbing. These can strip away natural oils, irritate the skin, and even cause tiny tears. So the plan is simple. Use mild, unscented soap. Let soapy water run over the area. Clean gently. Rinse thoroughly. Dry the area by patting, not rubbing, including under the foreskin. You're aiming for clean, not sterile. Treat the skin the way you would treat any sensitive area you care about, not the way you clean a pan. Section 4, don't ignore pain or warning signs. Number 4, don't ignore pain, lesions, or other warning signs. Many men have a high tolerance for denial when it comes to their genitals. Pain with urination, burning, discharge, warts, sores, bleeding, all of these can appear, and some men will still tell themselves it will go away. Weeks go by, sometimes months. Pain, swelling, changes in color, lumps, or sores on the penis are messages from your body. They're not there to be ignored. They might indicate a sexually transmitted infection, a urinary tract infection, a kidney stone, or a bladder stone, especially if there's blood in the urine. They could point to a skin condition, and in rare cases, bladder cancer or penile cancer. Penile cancer is exceptionally rare, but when it shows up, it tends to be aggressive and destructive if ignored. Some of the saddest cases in urology involve men who noticed a sore, a scab, or a growing lump on their penis and said nothing for months or years out of fear or shame. By the time they finally seek help, the treatment required is far more severe than it would have been early on. If you feel that a doctor is judging you, find another doctor. Your health is more important than anyone's opinion. A good doctor's job is not to judge your sexual history or your mistakes. Their job is to protect your health and your future. But that can only happen if you show up and speak honestly. When something on your penis looks or feels wrong, new pain, new sores, unusual discharge, or blood, don't wait, don't hide, make an appointment. Section 5, stay in control and always prioritize safe sex. Number 5, stay in control and always make safe sex a priority. There's nothing more attractive in the long run than sex where both people feel safe. Safe from infection, safe from unintended pregnancy, safe from pressure, and safe from injury. When you're not anxious about STIs or pregnancy, you can relax, be present, and actually enjoy the experience instead of running mental calculations in the background. Condoms and other forms of protection aren't the enemy of pleasure. They're the guardian of freedom. There are many types of condoms, thinner materials, different sizes and shapes. Experiment. Find what works for your body. Involve your partner in choosing them. Turn protection into part of the ritual rather than an awkward afterthought. It can transform the experience. Beyond infection and pregnancy, there's also the matter of physical injury. One specific injury men need to know about is penile fracture. Technically, the penis has no bone, but when it's fully erect, the tissue is under significant pressure. If your penis is erect and a thrusting motion suddenly forces it to bend sharply, for example, if you slip out and strike the pubic bone instead of the vagina or anus, the hard outer layer of the erectile tissue, called the tunica albuginea, can tear. When this happens, men often report hearing or feeling a pop, followed by immediate pain, loss of erection, and rapid swelling that can make the penis look like an eggplant. This is a surgical emergency. If you suspect a fracture, don't wait at home to see if it improves. Go to the emergency room. Without timely repair, the chances of long-term erectile dysfunction and curvature increase significantly. Staying in control during sex means being aware of position, speed, and angle. It can help to hold your partner's hips and guide the movement rather than letting momentum take over completely. This isn't about fear, it's about awareness. Lubrication is another essential part of staying safe. Lack of lubrication increases friction, which can lead to tiny tears in the skin, discomfort, and makes accidents more likely. Lubrication isn't a sign that something is wrong with your partner. Many factors affect natural lubrication: age, hormonal changes like perimenopause and menopause, medications like antidepressants or antihistamines, stress, individual variation. Relying only on natural lubrication can be unfair to both people. Good lubricant makes sex smoother, more comfortable, and often far more pleasurable for both partners. Section 6. Don't keep your testicles in constant heat. Number 6. Don't keep your testicles in constant heat. Your testicles are located outside the body for a reason. Sperm production requires an environment slightly cooler than your internal core temperature. When the testicles are exposed repeatedly or chronically to high temperatures, sperm quality and quantity can decline. In some cases, this can contribute to fertility problems. Exposing your groin area to strong, moist heat for prolonged periods, for instance, sitting in hot tubs, jacuzzis, or steam rooms very frequently and for long stretches, can have an effect on sperm production. Using a laptop directly on your lap for extended periods can also raise local temperature. Keeping your phone in your front pocket right next to your testicles all day long can do the same. The solution isn't to panic about every bit of warmth, but to be reasonable. Limit time spent in very hot environments like jacuzzis or steam rooms. Place a cushion or lap desk under your laptop rather than resting it directly on your groin. Whenever possible, keep your phone in your back pocket or a bag instead of pressed against your testicles in your front pocket. If you're trying to conceive or you know you have fertility concerns, awareness of testicular temperature becomes even more important. Section 7. Be gentle when you masturbate. Number 7. Be gentle with your penis when you masturbate. Masturbation is normal, healthy, and part of most men's lives. The problem arises when the way you stimulate yourself trains your brain and body to expect a very specific, very intense type of stimulation that no partner can realistically replicate. One example is what many call death grip. This is when a man masturbates with a very tight, very strong grip, often very fast, sometimes combined with intense, concentrated pressure on one specific spot. Over time, the nerves in the brain start to associate climax and arousal with exactly this pattern. Then when this man is with a partner, a vagina, a mouth, an anus, the sensations feel too soft, too different, or not intense enough compared to what his brain has become used to. He might have difficulty becoming fully aroused, maintaining an erection, or reaching orgasm. He may interpret this as performance anxiety, a problem with the partner, or fear that he's broken, when in reality, His personal habits have conditioned his responses. Being gentle with your penis means choosing masturbation techniques that are closer in intensity and rhythm to what you would experience with a partner. Use lubricant. Take your time. Avoid gripping as hard as you physically can. Allow your body to experience pleasure, not just chase a quick release in secrecy and shame. Also, try to move away from the idea that masturbation always has to be rushed, hidden, and surrounded by guilt. The more shame you wrap around your own sexuality, the more anxiety tends to show up later during sex with a partner. Section 8. Don't smoke and take your overall health seriously. Number 8. Don't smoke and take your overall health seriously. If there's one lifestyle habit that consistently destroys erections, it's smoking. Smoking damages blood vessels throughout the body. Your penis relies on healthy, responsive blood vessels to take in and maintain an erection. Over time, smoking narrows and stiffens these vessels, making it progressively harder for enough blood to flow in and stay there. Erectile dysfunction in smokers is extremely common. Smoking is also strongly linked to bladder cancer, one of the most difficult cancers to manage. Treatment often involves repeated procedures looking inside the bladder with cameras, removing tumors, and in serious cases, major surgeries that permanently change the way you urinate for the rest of your life. Your erections aren't separate from the rest of your body. They're a mirror of good cardiovascular health, good metabolic health, and good mental health. All of these support good erectile function. Remember the statistic from earlier. Within 7 years, about 14% of men who develop erectile dysfunction experience a heart attack. Erectile dysfunction is a vital sign for vascular health. So what supports both your penis and your heart? Eating a balanced, healthy diet, rich in whole foods, avoiding smoking and minimizing drug use, moderating alcohol intake, regular aerobic exercise to support blood flow, resistance training to help support testosterone and muscle mass, managing blood pressure, blood sugar, and cholesterol, prioritizing sleep. Stress management is also essential. A little stress can be motivating, but chronic, overwhelming stress slowly eats away at your health. It affects your hormones, your sleep, your mood, and your sex drive. Long-term stress increases the likelihood of erectile difficulties, even when your physical health is intact. If changing habits feels overwhelming, start small. Build small, sustainable habits. For example, a short daily walk, one healthier meal choice a day, one step toward quitting smoking. Tools like the small steps approach or atomic habits are powerful because they focus on realistic changes that accumulate over time. Your penis will thank you, and so will your heart. Section 9. Be kind to yourself, not just your penis. Number 9. Be kind to yourself, not just with your penis. When something goes wrong sexually, men tend to turn the full force of their self-criticism on themselves. One episode of lost erection, inability to finish, or feeling off balance can echo in a man's head for weeks. Here's what often happens. A man has one experience where he couldn't get or maintain an erection. The next time he's with his partner, he thinks about that incident the whole time. What if it happens again? What will they think? What does this say about me? That fear and anticipation trigger anxiety. Anxiety activates the nervous system in a way that actually makes it harder to have an erection, so the feared event is more likely to happen again. Now the anxiety is even stronger, and the cycle tightens. If you respond to this by mentally attacking yourself, calling yourself names, comparing yourself to other men, catastrophizing the worst, you're pouring fuel on the fire. Secrecy, self-hatred, and shame are not treatments for erectile problems. Everyone, without exception, will have fluctuations in sexual performance over a lifetime. Illness, fatigue, stress, alcohol, new medications, relationship struggles, all of these affect erections. One bad night or a few bad nights does not define your manhood, your worth, or your future. Being kind to yourself means acknowledging that something didn't go well today. That's okay. Let's see if it continues. If it does, I'll look into it. But I'm not going to destroy myself mentally over it. It also means talking, either to a partner, a trusted professional, or both. Men often keep this all inside, which magnifies the anxiety. Sharing the worry is often the first step toward breaking the cycle. Section 10. Use it or risk gradually losing function. Number 10. Use it, or you risk gradually losing function. Your penis isn't just a passive structure, it's living tissue that needs regular blood flow. Normally, during sleep, men have nocturnal erections, usually 3 to 5 throughout the night. These nighttime erections bring oxygenated blood to the erectile tissue and help maintain its health and elasticity. If, for some reason, a man stops having regular erections, whether during waking life or at night, the tissue can begin to change. Reduced oxygenation and blood flow can encourage subtle scarring, less elasticity, and in some cases, slight shortening over time. Men may notice that their penis looks or feels different, even when they're not sexually active. Additionally, desire is partly habitual. If you have persistently low sex drive, whether from stress, depression, hormonal changes, relationship difficulties, or other reasons, and you avoid sexual activity completely for a long period, your brain may begin to downregulate sexual cues. The drive becomes weaker, and it can feel harder to reignite. For some men, this isn't a problem. Not everyone needs or wants frequent sex, and that's completely valid. But if you're in a relationship where intimacy matters to both of you, or if you personally want to maintain your sexual function, completely ignoring your sexuality for extended periods can make it harder to come back. Sex and intimacy offer many benefits: bonding, stress relief, physical pleasure, emotional closeness, and sometimes even protective effects for cardiovascular and mental health. No matter your age, no matter what you do, if you and your partner value intimacy, it deserves care. This can mean scheduling time together, communicating honestly about needs and fears, and being willing to adapt your sex life as bodies and circumstances change. If you notice that nighttime erections have disappeared, or you never wake up with any degree of erection, that's another reason to check in with a doctor. It could be a sign of underlying health issues that deserve attention. In summary, yes, there is meaning to use it or lose it, in the sense that keeping your sexual system engaged through erections, intimacy, or masturbation can help maintain tissue health and the pathways involved. And remember, caring for your penis means caring for your whole self: your physical health, your emotional health, your relationships, and your habits. You're not just a collection of organs. You're a whole person. Treat yourself accordingly. Health isn't built in a day. It's built in small, steady decisions. Choosing honesty over silence, choosing care over neglect, choosing compassion over judgment. Your penis is more than a symbol of masculinity. It's a messenger, a vital sign, and a part of you that deserves respect and attention. If something I've shared today resonates with you, if you recognize yourself in any of these patterns, I want you to know this: you're not alone. These concerns are more common than you think, and seeking help, whether from a doctor, a therapist, or even just opening up to someone you trust, is not a sign of weakness. It's a sign of wisdom. Your body is speaking. The question is, are you listening? Thank you for being here today. Please take care of yourself, because you truly are worth it.